Hi, I'm Steve Selling, founder of FitTest, and in part 4 of my series on aortic stenosis for exercise professionals, I'm going to guide you through how I estimate systolic blood pressures adjusted for the pressure drop across the stenotic aortic valve, and to show you how I do that before exercise, in other words, at rest, and also during exercise. And by making these adjustments, I'm confident that I'm making the exercise safer in the setting of at least moderate aortic stenosis. So very quickly, a reminder of what it is, aortic stenosis. It's a valve that is tight in terms of its ability to open. So in this case here, we can see calcification on the 3 leaflets of the aortic valve, and this makes the aortic valve tight to open. And so what happens is the left ventricle has to work extra hard in order to overcome the obstruction across this narrowed valve. And in so doing, the pressures need to be greater, and there's muscle hypertrophy that needs to go on in the left ventricle in order to overcome the obstruction to produce at least sufficient flow for stroke volume and cardiac output. So what we get is a pressure drop across the narrowed valve, and that pressure drop in this case is about 40 millimeters of mercury. So what we recognise is that the left ventricular pressure, represented with the green pressure waves, are greater than what you would actually measure in the aorta, and of course what you would measure in the brachial artery when we do a normal blood pressure cuff measurement of brachial artery pressure. So the message that I made on this slide, and incidentally this was in part 1, explained in more detail of this series, is it is pointless to know what brachial artery pressure is without also having some idea of what this pressure drop is across the narrowed valve. In other words, the left ventricular to brachial artery pressure gradient. It's really important that we know what that gradient is. And these figures here for mild, moderate, severe and critical disease represent the pressure drops across the narrowed valve. In other words, the difference between left ventricular systolic blood pressure and brachial artery, or if you like, aorta pressure, systolic blood pressure, and then some indication adjusting back for what is happening in the brachial artery. So now coming to how I work with this concept. So if we take mild disease, mild aortic stenosis, where the aortic valve opening is in the area of 1.2 to 1.8 centimetres squared, and the mean gradient drop across, the mean pressure drop across the stenotic valve is in the range of 12 to 25 millimeters of mercury. So if we now take some examples of brachial systolic blood pressure, so we're measuring systolic blood pressure in the normal place in the arm, upper arm, and we just take a range of 120 through to 160 millimeters of mercury, for example, for our resting or pre-exercise systolic blood pressure. If we don't know what the actual number is, and that's very often, so this is the most common scenario, this is a less common scenario when you actually know what the gradient is. So the more common scenario I'm dealing with first is when you don't know what the pressure gradient is, because the referring medical practitioner hasn't told you what it is or hasn't provided that information on the referral. But on the referral, you do need to know what the severity of disease is. You cannot proceed unless you know what the severity of disease is. So at least it should be categorised as mild, moderate, severe or critical. And of course, we're not going to see people with severe or critical disease. But in the case of mild or moderate, we need to know what the severity of disease is, at least in that broad category. Now, if it's unknown, if the pressure gradient is unknown, we're going to use the upper figure as the assumption. So we're going to add 25 to our brachial pressure. And so our estimate of left ventricular systolic blood pressure compared to brachial, we're adding 25 and we get these numbers here. And so for the 160 brachial, that's just tipped us over that upper level for which we wouldn't start exercise, or we would have to start exercise at only, or limit exercise to just very low intensity exercise. So there's a red flag there. If someone presented with mild disease with a brachial pressure of 160, in other words, they've got hypertension overlaying the mild aortic stenosis, then that means we're starting with a left ventricular systolic blood pressure of 185, and that's the red zone. Now, if we do know it, and I've just given an example here of a gradient of 20 millimeters of mercury because it was on the referral, then we get this data here for our estimates of left ventricular systolic blood pressure. Now, we can go on from that and we can actually produce our stopping criteria. So this is what I've done here, is just our pre-exercise or resting criteria or resting estimates. And now we can overlay the stopping criteria here. So we're going to stop exercise if the estimated, that's these estimates in these two columns on the right, reach your stopping criterion. So for example, if the LV aorta pressure gradient was 20 millimeters of mercury in this example, then the brachial artery pressure stopping criterion needs to be reduced by that 20. So for example, if you normally stopped exercise at 250 millimeters of mercury systolic blood pressure on the brachial artery, now we would stop at 230. And if you stopped at 220, now we would stop at 200, and so on and so on. So it's a pretty easy estimate, and this is will guide you on how to do it. Now we come to moderate disease now. So for moderate disease, if we don't know what the LV aorta pressure gradient is, then we would add the upper number of 40 millimeters of mercury for that moderate disease. And so now we have a lot more pressures for that same pressure range, brachial artery pressure range. We have 3 numbers now where we're going to hit that red zone and we're not going to exercise someone. So this reinforces that if someone has systolic hypertension, as in brachial artery hypertension, overlaying moderate aortic stenosis, there's not a lot of room to move at rest by which you could even institute exercise. So really this reinforces the need for systolic hypertension to be really well controlled before you can start exercise in someone with moderate aortic stenosis. And if we do know the gradient, I've just given an example here of 30, that gives us a little bit more leeway. So now we've still got 2 in the red zone, but we have 3 pressures here in that we could still exercise that person, 120, 130, 140 systolic brachial artery pressure. We add the 30 and we get these numbers here. So again, I'm just exactly the same as the previous slide for working out your stopping criterion. The message is that whatever your gradient is, whether it be your assumed gradient of 40 or your actual gradient of 30, you need to reduce that. You need to reduce your stopping criterion by that gradient, by that amount. So instead of stopping in this example at 250, I've just used the 20 again, but it's the same principle. If, for example, you were using the 40 millimeter of mercury estimate here, you would reduce the 250 by that 40, and we would stop at not 230, we would stop at 210. I'm sure you can work with the principle here. It's really just a matter of doing a bit of arithmetic. And the main thing is know what your severity of disease is, know what your brachial artery systolic blood pressures are, both at rest and if possible during exercise, and make the adjustments. Now we're coming on to severe disease, and I just want to remind you that severe disease is absolutely contraindicated for any exercise beyond very low intensity, low volume exercise such as gentle walking, but even that would not be an extended walk. These people need to have a medical intervention, either aortic valve replacement or transcatheter aortic valve implantation / replacement, catheter approach or an open chest approach, but they need to be treated. And so these are really just theoretical numbers here, and I wouldn't exercise any of these, any person with severe aortic stenosis, and they shouldn't be referred to you for exercise anyway. And to come to critical disease, it's exactly the same message. I just want to emphasise to you in critical disease that in the examples that I've developed in this presentation, every single one of those is in the red zone for blood pressures. So it's just nonsensical to be exercising people with this sort of severity of disease. And the only thing you might possibly do in severe disease is offer someone a bit of gentle exercise by way of prehab, but that would have to be with the knowledge and total consent of the referring medical practitioner and especially the cardiologist. So now I come to the summary of this presentation. Exercise professionals must know the severity of aortic stenosis. You need to know at a minimum whether it is mild, moderate, severe or critical disease. And of course, they should not be referring to you if it is in that latter two categories of severe or critical. We need referral information. So that's a starting point. If you get someone with aortic stenosis, they need a medical referral to you. The brachial artery systolic blood pressure does not indicate left ventricular systolic blood pressure in the setting of aortic stenosis unless you start doing some adjustments. And that is that if left ventricular to aortic pressure gradient is known, then you can add that to brachial artery pressure to get an estimate of left ventricular systolic blood pressure, both at rest and during exercise. If that pressure gradient is not known, but the severity is known, then add the larger number at the end of the range for that intensity to estimate, to brachial artery pressure to estimate left ventricular systolic blood pressure. And if the pressure gradient is not known and the severity is not known, you simply do not exercise someone. I'll just say that again. If the pressure gradient is not known and the severity is not known, do not exercise your client. And then I'm just going over this stopping criteria again for exercise. So stop exercise if the estimated left ventricular systolic blood pressure reaches your stopping criterion. For example, if the pressure gradient was 30 millimeters of mercury, then the brachial artery pressure stopping criteria needs to be reduced by that 30 millimeters of mercury. So instead of stopping at 250, you'll now stop at 220 brachial. And there's no need to do anything about diastolic blood pressures. They don't come into this at all. So thanks for listening to this short video on aortic stenosis, and I hope it will guide you to how you can work safely in the setting of aortic stenosis with or without systemic hypertension, and knowing when to start exercise and when to stop. Thanks for watching this video, and you can contact me at info@myfittest.com.au. Bye for now.